country's coronavirus infection rate slowed down for a fourth successive day on Wednesday as further evidence emerged that a painful, long lockdown against the pandemic was finally working. But Thursday's data also showed a sudden jump in deaths in regions with big cities such as Naples in the south and the capital Rome in the center of the country. Health officials reported 683 fatalities across the nation of 60 million people, largely in line with the numbers over the past 4 days. Over 7,500 have died, and we have Hemegora, who is an Indian nurse, joining us live from Turin. He himself is treating 40 patients as his hospitals treat over 140 cases as we speak. Thank you so much, sir, for joining us here on Republic TV. First up, take us through how grave is the situation like on ground in Italy. We have been listening and also reading up news reports from the country as to how grave the situation is. What are the challenges you are currently facing, and how many number of cases do you come up with every single day, specifically talking about the region that you work for?
Yeah, ma'am, it's it's a bad situation here. And as usual, day to day, the number of positive cases are increasing. And these are all the cases we are seeing now who are all positive when they are first 15 days period. Because this is all the cases when the first lockdown has been happened from February 16 to March 1st. This is the cases were coming from that time, and really we are getting around 5,000 cases daily and around 600 to 800 deaths daily from last week. And now the situation is it's going very crucial. Now we are only recovering overall on critical stage, like we're in third and fourth stage. And we are treating all the patients and who are all very critically ill, as it affects on the respiratory system. And we are treating with several types of the oxygen masks and all. And in the case of they are not recovering with that, and we are doing with the ventilators.
Right. In fact, sir, another question for you. Are there enough hospital beds or the medical equipments available at your hospitals to make sure that the influx of these patients who come to you with serious respiratory problems on account of COVID-19 can be treated? Also, here in India, we have also started with this 21-day lockdown. What message would you like people to get from Italy, which is facing currently the worst situation in the entire world?
Yeah, this is the oncoming. I'm coming on live for this only because we know the population of India, how much it is there. We are, as a developed country, we are not able to sustain these cases, whatever actually 5,000 cases daily coming. In 5,000 cases, hardly 1,000 cases are very critical because of old age population. I request all Indians, as a brother and as one Indian, I request you, this situation should not happen in India, because if it comes to in India, whatever the figures we are dealing here from last 1 month, this one, within 1 day we will cross the numbers in India. That's why I request all the publics of India to remain in their house and to support to the government. As Modi ji told, it's a very, very crucial one. It's not like that simple flu or like that. We also, all the Italians, they taken very negligence, and we also thought like that, as we are, most of all the Italians are, they're very fit, they're very food cautious, and they're very good in diet and everything. But instead of that, we taken a negligence, and today we are facing a real problem. That's why it should not happen in India, because you know the health system, because we are having the large population, and we could not able to, as our country is less populated, we are less dense, we could not able to provide them sufficient beds, because here the population is like around 8 crores or like that. For 8 crores, we are having around 1,000 to 1,500 or 2,000 beds, ICU ventilators. I am telling you about ventilators. Yeah, these ventilators are we are having, and we could not able to offer everyone, because here every old age people who are coming with the critical situation. That's why we could not able to respond their ventilators to everyone. That's why I request all the Indians to stay back their home,
Right.
and I beg them, because it should not happen, because your loved ones are with you, and here the condition is going bad, because due to lockdown you could not able to, who are going to be dead, we could not able to afford their families to come and see them, and they can do their death ceremony or anything, because these are all not happening. We are directly taking them to the government. We are handovering to the government, and government is doing all the death ceremony and all. That's why I request all the Indians to stay back their home and to support to the government and support to Modi ji.
So, one last question. A large number of those in Italy who have been affected by this are above the age of 60. How difficult is it to treat people who are of elderly age? Is that a big challenge that you face currently?
That's why the death rate is increasing in Italy. The main thing is here the population is old age. The old age peoples, they have already associated with the other diseases like cardiovascular diseases will be there, some of the respiratory problems will be there, and some of other problems are there. Instead of that, including that also, this virus when it enters, they can't able to take respiratory system once again back to their regain their immunity power. And as you know, when you grow older, your immunity power will be less. That's why we are telling who are all less than 10 years, the children, so who are all having the less immunity power, and also above more than 60 years who have the less immunity power. Who have less immunity power, this virus attacks more. That's why we are telling children and old age people to stay more in home, and which are all the necessary things you need. You can just request to who are all young in your families to go and take that, and if it's possible, you all remain in house and take care of yourself. This is the main cause of old age people. There are many
Right.
in Italy. That's why they are not regaining their respiratory system. That's the main problem, ma'am.
Right. Thank you so much, Emegora, for joining us live all the way from Turin, Italy. And an important message coming in all the way from Italy, who himself is a nurse working at a hospital and treating patients of COVID-19, that stay indoors and make sure that you protect yourself by not venturing out.